Which enzyme degrades fluorouracil, capecitabine, and fluoxuridine? So these are example of pyrimidine analogues, and these pyrimidine analogues are degraded by dihydropyrimidine dehydrogenase. Okay, so fluorouracil, 5-fluorouracil, capecitabine, and fluoxuridine, they are degraded by dihydropyrimidine dehydrogenase. Which enzyme degrades cytidine analogues? So cytidine analogues are also a type of pyrimidine analog, and they are degraded by cytidine deaminase. Okay. Exam- Example is azacitidine is degraded by cytidine deaminase. What is 5-fluorouracil classified as? So 5-fluorouracil is a prodrug. So 5-fluorouracil is a prodrug. When it enters the cell, it's get converted into 5-fluorodeoxyuridine monophosphate. So 5-FU is a prodrug. What does 5-fluorouracil inhibit? So it inhibits thymidylate synthase. 5-fluorouracil, it inhibits thymidylate synthase. Which combination increases the effect of 5F? Which combination increases the effect of 5-fluorouracil? So folinic acid is a cofactor of thymidylate synthase, and it increases the effect of 5-fluorouracil. See, for methotrexate toxicity, we use folinic acid. Folinic acid is the antidote for methotrexate toxicity. But in case of 5-fluorouracil, folinic acid increases the effect of 5-fluorouracil. Which drug reduces the toxicity of methotrexate? So folinic acid reduces the toxicity. It is the antidote for methotrexate toxicity. Which drug is given IV along with platinum for gastrointestinal tract and head and neck cancer? So 5-fluorouracil, which is a pyrimidine analog, it is given along with platinum for GIT, head and neck cancers. Which drug is given for breast cancer treatment? See, fluorouracil is given for GIT, neck and head cancer, and for breast cancer capecitabine is used. Capecitabine, it is a oral prodrug of 5-HU. Capecitabine is a oral prodrug of 5-HU, and it is used in treatment of breast cancer. Okay. Capecitabine is the oral prodrug of 5-HU, whereas fluoxuridine injected for metastatic colon cancer treatment. So the colon cancer, it can metastasize to liver, and in this case fluoxuridine will be injected into the hepatic artery. Colon cancer ka metastasis can be to the liver, and in that case fluoxuridine is injected directly into the hepatic artery. Which drug is an antifungal drug which is converted to 5-FU? So flucytosine, it is an anti drug which is converted to 5-FU. Flucytosine is an antifungal drug. Which drug is the drug of choice for AML treatment? So citrabine, it is a pyrimidine analog. Its other name is cytosine arabinoside. So citrabine is the drug of choice for AML. What are the characteristic side effects of citrabine when administered intrathecally? So intrathecally, when citrabine is injected, it can cause ataxia, diplopia, and also cerebral toxicity. Ataxia is lack of coordination. Diplopia is double vision. Azacitidine and dacetabine, these are hypomethylating agents. Azacitidine and dacetabine, these are hypomethylating agents. Azacitidine and dacetabine, azacitidine and dacetabine, these are hypomethylating agents. So which drug is the drug of choice for myelodysplastic syndrome? So azacitidine, which is a hypomethylating agent, it is the drug of choice for myelodysplastic syndrome. Azacitidine. Gemcitabine is considered the drug of choice in which type of cancer? Pancreatic cancer. Gemcitabine is the drug of choice for pancreatic cancer. What is the key side effect of gemcitabine? So the side effect of gemcitabine is pneumonitis. Pneumonitis is the inflammation of the lung tissue. So the most common side effect of gemcitabine is pneumonitis. So which regimen is commonly used in treatment for colorectal cancer? Folfox, Folfree. And इसके साथ bevacizumab is also used. So both A and B, that is Folfox and Folfree. Fol stands for folinic acid, F stands for 5FU. Here OX stands for oxaliplatin. Okay. In Folfree, Fol stands for folinic acid, F stands for 5-fluorouracil, and IRI stands for irinotecan. Okay. So these both regimen are used for colorectal cancer. Bevacizumab is also used. Bevacizumab is a anti-VEGF monoclonal antibody. Okay. It will prevent the tumor angiogenesis. Bevacizumab acts as a monoclonal antibody against VEGF. Hand-foot syndrome is caused by, so in hand-foot syndrome there will be swelling, redness, itching in the hand and foot due to capillary damage. Hand-foot syndrome is caused by 5-fluorouracil, capecitabine, and Pyrimidine. These all three drugs will cause hand-foot syndrome. 5-fluorouracil, capecitabine, these are pyrimidine analogues, and Pyrimidine, it's a folate analog, and all these three drugs causes hand-foot syndrome. Dihydropyrimidine dehydrogenase deficiency leads to contraindication of which of the drugs? So 5-fluorouracil. 5-fluorouracil is degraded by dihydropyrimidine dehydrogenase. So अगर इसका deficiency होगा, it will lead to the accumulation of 5-fluorouracil. So 5-fluorouracil is contraindicated in DPD deficiency. Folinic acid is a cofactor for thymidylate synthase. Okay, folinic acid is the cofactor for thymidylate synthase. Which drug combination can also act as radiosensitizer? So gemcitabine, it's also used as a radiosensitizer. It is used in the treatment of pancreatic cancer and also as a radiosensitizer, gemcitabine. Which pyrimidine analog drug has the side effect of fulminant diarrhea? So 5-fluorouracil. It will cause mucosal ulcers in GIT, and these mucosal ulcers in GIT will lead to fulminant diarrhea. So 5-FU, this can cause fulminant diarrhea. Citrabin is used in combination with which of the drug for AML treatment? Okay. So citrabin is used in combination with doxorubicin. So the regimen for AML is citrabin for 7 days of citrabin and then 3 days of doxorubicin. Which side effect is characteristic of cerebral toxicity associated with citrabin? So citrabin causes diplopia, ataxia, and slurred speech. So all of these are the characteristic of cerebral toxicity associated with citrabin. What is the major action of azacitidine and dacetabine? So azacitidine and dacetabine, these are hypomethylating agent. They causes methylation of DNA. What is the function of 5-fluorouracil in chemotherapy? So it inhibits thymidylate synthase. Which drug is not given orally? So 5-fluorouracil is not given orally. Why? Because it is rapidly degraded by the enzyme dihydropyrimidine dehydrogenase. Okay. So 5-fluorouracil is not given orally because it is rapidly degraded by dihydropyrimidine dehydrogenase. Hand foot syndrome is associated with which drug? It is associated with 5-HU, capecitabine, and also Pemetrexate. So hand foot syndrome is associated with 5-fluorouracil, capecitabine, these are pyrimidine analogues, and Pemetrexate, which is a folate analog. These all causes hand foot syndrome. What is the role of thymidylate synthase in pyrimidine analog? Thymidylate synthase, it uses folinic acid as cofactor and it is inhibited by 5-fluorouracil. Which drug is given as a topical cream for mycosis fungoides, BCC, and keratosis? So 5-fluorouracil, it is given for mycosis fungoides, BCC, that is basal cell carcinoma, and keratosis, which is a precancerous condition. What is the mechanism of action of dihydropyrimidine dehydrogenase? So dihydropyrimidine dehydrogenase degrades the pyrimidine analogues like 5-fluorouracil and floxuridine. So dihydropyrimidine dehydrogenase, it degrades the pyrimidine analogues. What is the function of fluocytosine? So fluocytosine is a antifungal drug which is converted to 5-fluorouracil. Which drug is the most commonly associated with pneumonitis as a side effect? So the gemcitabine is associated with pneumonitis. Gemcitabine. What are hypomethylating agents? Drugs that prevent DNA methylation are known as hypomethylating agents like azacitidine and dacetabine. Okay, so these are hypomethylating agent. Azacitidine and dacetabine, these are hypomethylating agent. What is the use of bevacizumab in colorectal cancer? So bevacizumab is a VEGF inhibitor, vascular endothelium derived growth factor inhibitor, and it prevents the angiogenesis in tumor. Cytosine arabinocyte or cytarabine is associated with which side effects? It is associated with cerebral toxicity like ataxia, that is lack of coordination, diplopia, that is double vision, and then slurred speech. Which type of cancer can 5-HU treat when given with platinum compounds? So 5-HU is given with platinum compounds to treat GIT, head and neck cancers. Which agent prevents DNA methylation and acts as drug of choice for MDS, that is myelodysplastic syndrome? So azacitidine, it is a hypomethylating agent. It will prevent DNA methylation and will act as the drug of choice for myelodysplastic syndrome. Which drug is given as a part of FOLFOX and FOL-free regimen? So FOL, the FOL in FOLFOX and FOL-free stands for folinic acid, and the F stands for 5-fluorouracil. So 5-fluorouracil is given as a part of FOLFOX and FOL-free regimen for colorectal cancer. What is the major side effect associated with 5-FU and capecitabine. So 5-FU and capecitabine, it causes mucosal ulcer leading to diarrhea, yes, fulminant diarrhea, and it also causes hand-foot syndrome. So 5-fluorouracil and capecitabine, which is the oral prodrug of 5-FU, it causes mucosal ulcer leading to diarrhea and also hand-foot syndrome. Gemcitabine has additional role in cancer treatment, that is as a radiosensitizer. Citrabin has a combination treatment with which of the drug for AML. So for AML, citrabin is used and also doxorubicin is used. So the regimen for AML is use citarabin for 7 days and then doxorubicin for 3 days. 5-FU inhibits which key enzyme in pyrimidine metabolism? So it will inhibit thymidylate synthase. Which drug has a side effect linked to cerebral toxicity and slurred speech? So citarabin, it causes cerebral toxicity. Okay, it will cause diplopia, slurred speech, and ataxia. Capecitabine is associated with which side effect? Capecitabine causes hand-foot syndrome. It is the oral prodrug of 5-FU and they cause hand-foot syndrome. Which agent is used as radiosensitizer that enhances radiation effects? So gemcitabine is used as radiosensitizer. What is the mechanism of action of azacitidine action? Azacitidine is a hypomethylating agent, so it prevents DNA methylation. Citrabin is most effective in treating which condition? So citrabin is used in treating AML.